Hi, I'm Dr. Matt Schaefer. We're here today to do dentistry on a 4-year-old appendix quarter horse named Goliath. And we've given him a little light sedation. His head is dropped. We're working in a nice stall. We prefer to work in a stall where the horse is confined and can't back away on us, because they like to do that sometimes. This is an ideal stall because we have a lot of room, but yet we have a wall and we have gates that if the horse backs up to, it restricts his movement. In the mouth we see on this horse, probably his first dental examination, we have points forming on the upper teeth, upper molars on the outside edge next to the cheek. If your camera can see this and picks up, you can see little marks inside the cheek, and you can see the sharp points coming off the outside edge of those molars, making it fairly uncomfortable for this horse to eat very well on a regular basis. But the important thing here, this horse is going to be ridden with a bit, and these points here and here and here will interfere if the bit pulls any of this loose cheek up into these points, causing the horse to lift his head, toss his head, and not obey commands properly. We're going to go ahead and round all these points off and make sure that we have nice molar occlusion between the top row of the teeth, top row, and the bottom row of molars. We'll make sure that they match up. And if I move my head and hold the mouth open, maybe everybody can see that with the camera. Wait till we get some good focus here. And
Okay.
okay? All right. All right. If you want to check this side out here, I'll pull the mouth open. You can see. As you can see, this full mouth speculum that we use with the light attached really facilitates our visualization of the entire teeth. In order to do dentistry properly, you should be able to see, touch, and feel every tooth in the horse's head. I'll turn the light off to show you the difference that this makes. You can see everything in there and make sure we know what's going on between all the teeth. Okay, now we'll do I like to use power dentistry in all my work. It does a better job. Guarded rotary burrs, rotating discs are kind of the way I do things. And it just makes it a lot easier, and it's a lot easier for the horse, and does a tremendous job. I'm now taking the point towards the back of the mouth. Alright, and then you can see the rounded edge. Where it once was very sharp and pointy. Not quite done yet, but you can see the difference as it's being filed. Okay, if you want to shut it. So we've got we're switching to the other upper molar table here. And what we're going to do is the same thing as before. Try to get both sides matched up, balanced out. The nice thing about power equipment is that it makes this job go really fairly quickly, so it's easier on the horse and the people that are assisting. Usually we can get one of these done within 10 minutes. If there's not any major malformations of teeth or upper protruding molars, it goes pretty quickly. I think a fair criticism of power dentistry that has been put out there is that you take too much tooth off. And I think that can happen. But I think a veterinarian with experience that is using common sense takes off what he needs to make the horse's molar tables balance and match up with one another. I try to stay off the occlusal surface or the top of the teeth that come together and just take off what I need, never leaving the burr on for just more than a couple seconds on one spot. But yet getting it a nice round appearance to the edges and putting on a proper bit seat or that front part of the premolar that might rub up against the cheek when a bit's in its mouth. Okay, now we're going to switch to the bottom rows. Why don't you kill it there and go ahead. Let me sedate him just a little. We can see that the top teeth are done pretty well now. We got our nice edges, our round bit seats placed by the molars up front here. But now we'll work on the bottom rows, which have some fairly sharp points in by the tongue. Notice how the points form on the inner surface on the lower teeth, which will poke into the tongue. And now we will round the front of the premolar off so we don't have a problem with bitting there. And go all the way back to the back of the mouth, making sure our edges are as round as they are on the top outer edges of the upper teeth.
She bred 3 horses this year, but I don't know if any of them touched.
She bred 3 again this year, and none of them are touched again?
We don't know.
Do you have any babies on the ground?
Now we can do the side-by-side. Here we have a side-by-side comparison. We just did the work on the lower right side of the horse's molar table. You can see we have the nice round bit seat in the front here. Not taking too much tooth, but just enough to round it. And we can compare it to the side that we didn't do with the sharp points on the left side of the horse. So if we can get a shot side-by-side. I'll see if I can open. Okay. Here's our completed horse. There we go. Kick this out of the way. Okay. Here's the completed work where you can see everything that has been done. Notice how the teeth are not filed level. We stay off the occlusal surface and we make sure there's at least a 15-degree tilt to both the top and the bottom occlusal surfaces of the molar tables. Occlusal surface is the top where they meet and touch and grind their food. We want to keep that angle so they can chew in a nice circular motion. And when they're balanced like this, the top matching up with the bottom, they won't get points. A lot of these horses won't have to be done for 2, sometimes 3 years once they're 10 years old. However, we don't recommend that. We recommend that we check these horses at least once a year. But that doesn't mean we have to do them every year. Some horses are different. Some horses, because of the shape of their jaw and problems with maybe their temporomandibular joint, or if they have an overbite, will need to have their horses or their teeth done more often. But when they're balanced, this offers the best value for your money in getting them completely lined up, all the points and all the waves taken out, and they should last a long time. This horse has very nice teeth. All the molars are there and present, and there's no big spaces between any of the teeth. And he should. He's only 4 years old. He has he has a complete set of adult teeth with his last molar way in the back that's just come in through the gum line.